Hey, welcome back. Today we're going to do a little bit of massage gun 101. Most people do have a massage gun at home, but have no clue how to use them. Most people are only using just this attachment. And while this is a good attachment, it doesn't really have a lot of surface area as far as this goes. So it's good for certain parts of the body. But I mean, if you're using like bigger muscles, your chest, your arms, your legs, you're going to want that flat attachment. So when you go into that, you're pretty much going to want this attachment on your gun. There are other attachments. A lot of the massage guns you get also have like maybe 6, 8, 9 attachments. So which ones do you use? I'll say that these three right here are my top 3 ones to use. I'll use a lot of these for the forearms, the hands, and everywhere in between. So these are my top 3. You can use some of the other ones that are a little bit more pointy. You can use some of the ones for the spine, but these are my top 3 to go to. So for this one, you can actually do sinuses, you can do TMJ type issues, which is the jaw, and it really does give you a lot of relief. I will give you a little bit here. As this kind of vibrates here, you don't want it like flat against the body. You want it just so it's barely touching, okay? So if it's like really, you're not trying to dig for gold, okay? So when you're doing some of these sinuses, you're gonna go up along the ridges here, all along the ridges. And so you're just gonna barely come in here and just barely love tap it, okay? And I will even put this, especially when I'm doing sinuses, on its max setting. And again, you're just barely touching the sinuses right in there. And you're going all along here, making sure you don't push too hard. So again, it's just barely love tapping. And then you come here, right into the middle. This one usually feels pretty good, especially if you have sinus issues. A little congestion, all that pressure in there. Then you come along the ridge on the other side until you come down to right here under the cheekbone, okay? And so I'll usually do this for about a minute, twice. And that just helps free this up. It might make your nose itchy, by the way. And so, yeah, true story. And but this one's really good for just the sinus cavity area. And then switching over, we're going to talk a little bit about the TMJ. That is these big muscles right in here that help that mouth move. A lot of time when you're eating really chewy food, that can irritate the TMJ, especially if you have TMJ issues. There's a little disc in between the jaw that can actually slide back a little bit. That's something that we would adjust. But the muscles around there, the muscles can get really tired too. And so this is actually very nice to use just along these muscles. You have the masseter and the buccal muscles, and then you'll go right in here. And again, love tap. You do not try and dig for gold. You're gonna go along right here, underneath the cheekbone and a little bit in front of that ear. You're gonna go all the way down to the jaw right about here, and just get in there. Now, I will usually also have my client open and close their mouth as they're doing this, and that allows you to stretch and open that mouth. So then they'll open and close that mouth and close. There you go. And you just give those circular motions as they're opening and closing, and that usually feels really good in there, okay? So that is one way to use your massage gun for the sinuses, for the TMJ areas as well, and that's using the ball. You do not want that max surface area. If you do, it will feel like somebody's slapping you, okay? Moving on, we're going to talk a little bit about the forearms here. Again, for the forearms, I don't use the ball. I will use the flathead. And again, I do want that surface area when I'm doing the forearms. Can I scoot over just a hair more? So typically when I'm doing something like the forearms, you're going to want to have something for this to rest on. Usually my table will be a lot more to the ground, and I'll be able to get this. So I'm going to go ahead and just rest that here. Now you can use anywhere between max setting to mid setting. Mine only goes up to 30 as far as the numbers go. So I can go anywhere between 20 and 30 on my massage gun. And so I'll go from the elbow to the thumb in that direction. Usually when you're doing forearms, this is the main one, especially if you're having troubles in these fingers. A lot of people have thumb issues. And again, that is from the elbow to the thumb. You'll go at that direction here. And I do several passes this way. And I'll do that for about 30 seconds or so, and then I will actually start to rotate the arm as I'm going down in that direction. I'll rotate it back and forth, and I'm not digging for gold again. I'm not pushing hard. I'm letting the machine do the work, going back and forth just like this, okay? And I'll do this for about a good minute, and then I'll go up and down with the hand, just like this, up and down. So I'll go up and down. And you're trying to get a massage while you're doing a stretch with it, which is what we're trying to do. It's kind of like functional massage with the massage gun. And so I'll go back and forth, and then I'll go up and down with the wrist. And so that is good for a lot of issues, especially if you're having like forearm issues, if you're having that thumb and that index finger issue, if you're doing too much mousing, that's most people. That'll be this side of the hand, okay? If you have too much gripping, if you're using, for example, if you're using grip vices, or if you're doing stuff where your hands have to constantly be gripping things, you're probably gonna have an issue right here on the inside of your forearm. And it's gonna go all the way down. And it's gonna, again, you're gonna go from elbow to thumb in that direction. That's the way that the muscles go. And you'll do exactly the same thing, but on the other side. So in that case, you'd come from here and you'd work it all the way down to the thumb. So you go from here all the way down here, and again, same method. You'd go kind of like this, and you'd also be twisting it just like so, just like we did on the other side, okay? That's how you do the forearm for somebody who's using the hands. Construction people, for example, people that are electricians, people that are metal workers are very much gonna fall into that category where they're having to crush and move and use their hands all day long, okay? Moving right along, because the forearms get so used, especially right up in here, I will also just double check, you know, right up in here. A lot of people, they have like this little muscle right here. It's not the bicep per se, it's called the bicep brachii. It crosses over the elbow. So if you're having elbow pain, it's usually because you have a problem here as well. And there's usually like a little lump right about there. Feel that? Yeah, there's a little lump right about there. And that little lump shouldn't be there, okay? It should be nice and mushy, okay? But when there's a little bump there, you're gonna turn your massage gun on, and what you'll do, again, you want that functional massage, so you want that stretch while you're doing it. You're gonna go from this angle right here, you're gonna put it right here on that little part that I was talking about. It's not on the bicep, it's off to the side. You're gonna put it right on that little bump that we were talking about, and you're gonna go out and in, just like this, okay? Out and in, just like this. And so this is so much easier to do on yourself than it is to do on somebody else, because this is an awkward angle. But you can go out and in just like this, and I'm gonna do it for a minute twice. So usually I'll do a whole minute and do all of these things, and then I'll come back and I'll pass them again another minute. So that's using the flat head for most of the forearm and the bicep brachii. For the hand, I will go back to the ball, and this for the hand, and we'll use this one on the palm. And so for here, we'll come in here, we're gonna hit all of the fat pads. That's all of these guys right here. We're gonna hit all the fat pads right here, and that's really going to help the hand, especially if you do a lot of mousing or hand work, or, you know, pretty much 95% of the population needs to do this, by the way. You're going to hit right here, all along the fat pads, and then about every 5 to 10 seconds, I would even have the patient just grab the ball just barely lightly. You don't have to grab it super hard, but just kind of grab it. You feel that? Yeah. And that feels pretty good. And then open the hand, because if you don't open the hand, then too much friction happens, and then it warms up and it doesn't feel good. So it's good to kind of do that about every 5 to 10 seconds. You can then grab the ball again and just kind of rub it in like that, okay? That's gonna make this whole hand a lot more loose, and it's also gonna increase the circulation, which is what's usually missing when you're using them all day long. Okay, so I'll do that, and then I'll take this attachment off right here. I'll do one more thing. This actually didn't make it in our other film, and it was kind of nice. So I'm going to use this one right here. It's a little pointy one like this. Looks like kind of like a spatula. I don't know, most massage guns have it. Not all of them do. But if yours has this or has something similar to it, I would actually go in between the little fingers here, kind of hitting the fat pad and right in between the finger, and I'll just barely give that a little love too. Now, these guys get no care, no love all day long, but they get just used and abused. And so I'll go right in between there and hit all of these little guys right here. And usually this feels really wonderful, especially if you use your hands all day long. Your hands will feel nice and fluffy. Okay, that's a technical term, by the way. And just right in between. And again, about 1 minute twice is what I recommend. And then the hand will feel nice and loose, which is nice. That hand now feels like it's been gypped. okay? So again, back to using the flathead. I'm going to do one more here, probably two more. We're going to be doing the thigh. You can actually do this on the IT band. A lot of people have really tight IT bands, okay? So you'll take your massage gun and you'll basically do this with it, and then you come down into here. Now what's cool about this is you just lift the leg up and down. So you can do this on the side of a couch, up, down, up, there you go, up and down. Now for somebody who's probably been doing leg work, this feels really good actually. And you just kind of go all the way up this IT band right here. Now this is the tendon part of the tensor fascia lata, which is actually above the hip joint. And you're just going to get all of this, and you're just going to relax this. By lifting this and down, you can get this muscle pretty easily from your couch. There you go. Now, if you want to do one more thing here, to really help free up the hip joint, and this again, if you're sitting a lot, this is really up your alley. You're going to want to hit the IT band. You're also going to want to hit the piriformis. Usually when I'm hitting the piriformis itself, I'll actually do like a little squat while I'm doing it. So I'll just grab the massage gun like this. I'll put it right here, right where the piriformis is. I'll put it right about here. And then I will actually do like a little squat. And I'll come back up like this, nice and slow. And I'll do a little squat, and I'll just keep doing this little squat like this, and I'll come back up. And that's really going to get deep into that piriformis. So the IT band and the piriformis are married, which means if you have one, you usually have the other. So I'll do that for a minute twice, and I'll do the IT band for a minute twice. Sometimes, and every once in a while, you'll get like your hip feels like it's frozen, and you're getting kind of like that groin pain. That is the psoas, and that's actually attached to the lower lumbar, and then goes and attaches right up in here. If you sit too much, this can be too short, and that can actually then when you stand up on a pull and pinch, and that can really hurt. So if you're going to try and get that, you do not want this one, and it's not a very big area that you're going to hit anyway. You're going to get the ball, you're going to lay on the side for me, please. And then what you'll do is with your gun, it's so much easier to do it on yourself, but nobody wants to torture themselves, huh? You're going to get right, if you're looking at, you're going to get like right here, okay? So that's where this whole leg kind of, is able to lift up. There's a muscle that goes right in about here that you're going to put this massage gun. And then what you do is you lift the leg up and you go all the way out, just like this, up and out. You're going to really kind of just dig it right in there and all the way out. Now, I usually would do this on the bed or on the floor. That way you can kind of stabilize the rest of your body. But you're going to get right into that little area, that kind of groin area. You're going to hit right about here. And you're just going to open and close that leg up like that. That should give you some good relief. If you're hitting all three of those and you're having that pinching, that really will help out. Hopefully that was helpful and you've gotten some benefit of watching our video. We do have more health tips coming on the way. Take care, guys.